All right. Well, good morning. It is Monday, July 13th, 2020, and I want to thank everyone for taking time this morning to be on the call. I very much appreciate it. And as a reminder, I am recording these calls, and they can be found on our YouTube channel. So you can go to our YouTube channel. I send that link out via text message and email every week. So just click that link and save that channel. You can subscribe to the channel so that way when I release the videos, you're notified right away so you can, save those videos and watch them at your convenience. Also, the reason I do this is to archive videos. So those of you that are joining us for the first time on these calls, if you want more of these calls, if you think these calls are very, very helpful, then you can go back into our archive on our YouTube channel and absorb all the excellent information that we have hosted there. So as a reminder, go out to our YouTube channel, subscribe there, and make sure that you get all the information that you need to be a successful agent in this business. All right, so it is another week here, so we've got some training on the calendar. It's a little light this week again, and the reason being is because all the certifications and plans are releasing their 2021 training, and it's really important that you carve out time every week to do these trainings. So this morning, not much going on, but United Healthcare here locally in Orlando, our friends Al and Deb are doing a coffee and chat session for United Healthcare, and you can answer or get answers to your questions from Al, and that is at 9:30 this morning. You can access our training calendar and get the link there. Tomorrow, Tuesday the 14th, you'll be able to do a training for Humana where you can learn how to access your customer information, check on your application status, and submit service inquiries. That's a very specific training, probably the longest title of a training that I've seen in a while, but that is available tomorrow at 10 a.m. and you can learn how to use that portal specifically on Humana. On Wednesday, again at 9:30, our friends Al and Deb are back at it, and they are doing a United Healthcare Lean training, and that's pretty much anyone in the country can join this, but specifically this is for the Central Florida market. They might have some market specifics in there, but probably not a lot because this is a specific training for United Healthcare Lean, which is their electronic application tool that you'll need to learn during open enrollment. This is a great time to do that, and again, that's tomorrow or on Wednesday, the 15th at 9:30. Also on Wednesday, the 15th at 3 p.m., Humana is hosting low-income subsidy training, which is specific training for folks that qualify to get their prescriptions reduced by 95%. If you don't know how to help people save money with the federal government programs like low-income subsidy, take some time out and learn that. And the reason why is because you will become a resource. People will seek you out because you were able to help their aunt, their uncle, their nephew, their neighbor save up to 95% on the cost of their Medicare prescription drugs, and that is incredible. So it was always a great tool for me when I knew and learned about low-income subsidy and I started applying that to my customers. I would get referrals left and right, so it was a great tool for me to use. On Thursday, the 16th, 9 o'clock, United Healthcare is doing their chat with Al and Deb, and again, that's a coffee talk, very market specific. But again, if you're in another market, let's say in New Jersey or in California, you can check in with United's training calendar that's available on Jarvis, and they are doing coffee and chats all over the country, so you can find one that's closest to you if that's what you prefer. Also on Thursday the 16th at noon, there is a training that's being hosted by Humana, and this one is how to learn how to do assistance with state and federal benefits. Again, we just talked about that, but also they're going to include state benefits through Florida, which is specific for Florida on this particular training session. But again, Humana is doing this all over the country, so you can jump out to their national training calendar if you need to find one in your area. And last training of the week on Thursday at 2 p.m., Humana also is hosting how to do successful virtual meetings. And if there's one training that you should learn this week, if there's one that you attend, it would be this one. Why? Because the world is changing, my friends. More and more people are doing virtual meetings, virtual phone calls, and virtual enrollments. And if you don't know how to do this successfully, you may be left in the dust. If you're used to meeting people in person and doing a paper application, you are going to be left in the dust because people may not want to meet with you just because of the risk. And we were just talking right before the call. Here in Florida, our numbers have spiked again. I think we set another record for how many cases have been identified here in Florida. And that makes people nervous, especially seniors. So you need to learn how to do successful virtual meetings. And also, how can you teach people how to do virtual meetings? Because these seniors are very savvy these days. A lot of them that are turning 65 are coming out of the workforce directly. They have emails, they have computers, they have smartphones, they're very aware. And guess what? They also know how to do video chats because they're video chatting with their grandkids, okay? So there are no dummies to technology. So don't be a dummy yourself. Learn this stuff and really make sure that you understand on how to do it. So that's the training for the week. Again, it's a short week because we need to be focusing on recertifying and your certifications. So if you're just joining Health Plan Markets, then you're going to get contracting links, and those contracting links will have certifications where you'll have to go. Now, this is a great time because all the 2021 certifications are coming out. So as you go in there and you do your 2021 certification, it also certifies you for 2020. So you can actually start writing business immediately as soon as you get your ready to sell. You don't have to wait until October. So you can start applying all your marketing and everything right away and start making money right away. Okay? But these certifications, the recertifications, just be very careful because I'm sending out an email stating that these are the links on where you can recertify, meaning that you are already contracted, you're already ready to sell for 2020, you're just getting ready for 2021. So those are the difference between certifications and recertifications, okay? Make sure you get those done because most all the carriers are now out with their recertifications for 2021, including AHIP. So if you have not done your AHIP training, please get that done right away. We are less than 90 days away from open enrollment. Believe it or not, we are less than 90 days away from AEP. And so if you're not getting the stuff done, you're going to be jammed up when we get closer and closer. One thing I want to touch on the AHIP, Mr. Tom Ryan has done a great job. He's gone through the AHIP and he has some great information that I'm going to share with you this morning. The first thing is AHIP does have downloadable slides that you can download yourself on each module, and there's 5 modules outside of the fraud, waste, and abuse training at the end. But those 5 modules have slides that you can download and save. Now they are not searchable, okay? And all those folks that were out there using that as an open book test, they are not searchable. So you cannot search these. They're actually pictures inside there. But it's great training materials, okay? So Tom has downloaded those slides from AHIP and he has saved them in our Gold Key. So those are now accessible in your Gold Key. So all of you that have our Gold Key, you can open up your phones and you can find those slides in there, and that's all downloadable directly from AHIP. Again, you can download them yourself, but we've already done it and organized it for you on our Gold Key. So make sure you've got access to the Gold Key on your computer, your laptop, your iPad, or your phone, whatever you're using to access our Gold Key, you have that available. And some other news here in AHIP. Now, many of you have learned that there's only 3 shots that you get for taking the test. A lot of these companies are now backing off of these testing requirements, and I get it because a lot of us have test anxiety and we know our materials, but we get really nervous when we take a test and then we don't really, function normally as we do in the world. So the first thing to know is you can take AHIP again if you fail 3 times. And again, we don't want that to happen, okay? But they call this AHIP 2. And yes, if you pass on the second the second series of AHIP tries, then you will get a certification. But on that certification, it will say AHIP 2. Now, the thing about it is some companies accept it and some do not accept the AHIP 2. All companies accept AHIP 1, the first series of 3 tries that you get. So if you pass AHIP in that series of 3, that first series of 3, then you'll be accepted by all the carriers. But if you do not pass on the third time, you will have to purchase another AHIP credit of $125, $175, whatever it might be, and then you'll have to take it again. And if you pass on that second series of 3, that's called AHIP 2. But keep in mind, not all companies are accepting AHIP 2. So just beware of that. If you have questions on whether or not that's accepted, please reach out to us and we'll get the information necessary. But I hope I don't have to deal with any of that. I know you are all smart enough to get through that AHIP test as you've done every year. However, with AHIP, you need to make sure that you are learning the materials. This is not, just a test to trip you up or to mess with you. We do this annually because there are updates in there. So make sure you're learning the materials and you are doing everything that you can to understand it. Now, when you're taking the test, one thing that I will tell you is we recommend that you go through all the modules and take the test by yourself on the first try. So go through it, take it on the first try. If you pass, congratulations, you're done. We won't see you again for another 12 months. So that would be great. However, if you do not pass on the first try, please, please, please reach out to us so we can guide you on what you need to do to pass it on the second try. Okay, please do not attempt to take the AHIP without contacting us at the office so we can coordinate a training session with you to make sure that you get through that second test and make sure that you pass, okay? We want everyone to pass AHIP. It is critical in order to be in this business. If you do not pass your AHIP, then it makes life very difficult and limited on options for you to offer health insurance, okay? So we'll move on from there. We've got carrier updates here, lots going on. So make sure you're checking your emails. If you have an HPM email, everything is segregated. We recommend setting up folders so you can save your Healthfirst information, your WellCare information, your United information, your Devoted information, excuse me, all in separate folders so you can access it. I highly recommend never delete emails. Never delete emails. You can archive them or you can save them in folders, but never delete emails. When you delete emails, you will be in trouble because it takes a while to get back to the sender and have them send it out again. So save them in folders. If you do not have an HPM email address, we highly recommend you have one. We have our own server that we can send information out to you. But one of the best parts about having an email with us is that all of your health insurance information is in one spot. Okay, so you're not digging through your Gmail accounts or your Yahoo accounts trying to find a specific email throughout the 10,000 or 11,000 other emails that are coming into your inbox, okay? And a lot of times emails get sent to the spam or promos folder, so we do recommend that you have a dedicated email just for this business. And even if it's not with HPM, that's fine, but we offer one at no cost to you. You can have your own. Just reach out to John Minotti. Everyone should have his contact information, and we can get you set up with an email. Just in case, I want to make sure everybody's got one. Okay, now Healthfirst. Those of you that are selling Healthfirst and Advent Health, they need you to go in and update your information. They sent you an email out, and that is important because you will not get paid commissions unless you update your contact information. So phone number, address, email, license number, all that stuff has to be updated right now, and then go out and take the certifications. Also, that recertification is already out, so you can get recertified, and that's for Advent Health and Healthfirst, but it is mission critical that you update your information with them. Also, as a reminder, WellCare, because of their merger with Centene, Centene has purchased WellCare, Centene has sent out a brand new contract that you must sign. So if you are currently an active agent with WellCare and you have not yet signed your 2021 contract, this is between you, Centene, and WellCare. It must be done by September 30th. That is the deadline. If you fail to meet that deadline, you will be suspended, which means no commissions, no residuals. And if you fail to get that done before December 1st, you will be terminated. It's not fun to be terminated by WellCare, okay, or anybody for that matter. But if you are terminated, then you'll be blacklisted, which means you may not be able to sell that product ever again in the future. So just make sure you take some time. It takes about 5 minutes to read through the contract. It's a basic agent contract. Just get that done. It's a DocuSign. You don't have to print anything or download anything. You just go in your emails, click the links, and read it and sign it electronically, and you'll be done. Once you get that done, just please let us know. Shoot a little note over to Jessica so we can update it and make sure that you've got that done. She, again, will be reaching out to all those folks that have not gotten it done yet. So that's why she's calling you. She wants to make sure that you get your work done on that contract. So make sure you get that done. Speaking of contracts, big movement on a couple of carriers that I'm really, really excited about. Devoted Health is expanding in new areas and states. I'm really excited about them. So if you're new to this business, check out Devoted. That's going to be a really, really hot product next year. Same thing with Bright Health. We've already talked about earlier in the year about their new product offerings. Here in Florida, they're coming out for the first time ever, a give back PPO product that will reimburse folks their Medicare Part B premium that they're paying on a monthly basis. And it's a PPO. It's unbelievable. So we've seen these products in New Jersey and in other parts of the country, but this is the first time that they're going to be available in Florida. So I'm really, really excited about those product offerings, and that's from Bright Health. So again, those two companies, also Clover, those of you in the New Jersey market and up there, but they're also expanding into Texas and other places in the country, such as Georgia, which brings me to my next point. If you do have clients in other states, we are licensed in 15 states, moving into our 16th state very shortly. So just check with us, and we can help you get contracted and certified with any of those carriers in those regional areas that are specific in order to help serve your customers and clients in those areas as well. So don't be shy. You know, if you have a Georgia license or if you have a North Carolina license, we're licensed there and we can help you. And especially if you want to do marketing, we're glad to talk about what we can do to help you with that. So marketing, AEP. We are about 80 days out from AEP from October 1st. That's when we could start marketing our 2021 plans. But everyone's concerned, is the world going to look the same? What do I do for AEP this year, Justin? You know, last year I did my tabletops at the Walmarts, or I did seminars, or I did mail-outs, or I talked to doctors, or I did health fairs. You know, whatever that looked like in the past, great. I think you should have that as your plan A. Let's assume that everything's going to go back to normal, and that plan A is going to be there for you. But I need everybody to make sure that we have a plan B, because it may not go back to normal. The world may be very different. So what does that look like if you cannot get into the Walmarts, and you're not allowed to sit at the pharmacies, and you're not allowed to do seminars? What does that world look like to you? You need to start developing a plan B. What is your plan B for AEP? You know, so think about that. Again, virtual meetings are all part of that plan B. Virtual seminars, part of that plan B. I would say social media is going to be part of that plan B. And making sure that you're in contact with your clients, another great part of that project. So you need to make sure that you're ready to go for plan B, but also have your plan A in place. This is, if everything goes back to normal, this is what I'm going to do. But if it doesn't, I'm going to go and do this as my plan B. And we're going to be helping you develop your AEP planning, and we're going to do a special session on that, so stay tuned on that. We're going to do a training session where you can join me, and I'll walk you through on how to develop a plan of action for AEP and what HPM can do to help you with that. So deal of the week. we've got the deal of the week. So all of you that have joined me this morning, if you are interested, we will have the deal of the week is we're going to help you with your Facebook and Google. I think Google ads, we're going to give you $100 to spend on your social media marketing, but you do have to send me an email by 11 a.m. this morning. So please send me an email. It is July 13th. You got to send me an email before 11 a.m. this morning, and I will hook you up with a Google credit so you can get Google ads running for yourself and market yourself. It's $100 to start with, and that'll get you started with your marketing, and we'll help you develop the ad and all that good stuff. Our friend James is going to help you, so I'll shoot you over to James and make sure he reaches out and gets all that set up to you. But you have to shoot me an email before 11 o'clock this morning, and I will get that marketing set up for you, and you can get that credit. Okay, now, if you took your AHIP already, then you're aware of one big major change, and this is, if you've been in the business for a long time, this has always been a thorn in our heel. There's one medical question that has always limited us from helping people, and that is, do you have end-stage renal disease? Do you have kidney failure? And if you have stage 4 kidney failure, you have end-stage renal disease, and unfortunately in Medicare, they do not allow a person to join on Medicare Advantage plans except for 2021 coming up. This year will be the first year that you will ever be allowed to enroll people with end-stage renal disease, and I anticipate that question will no longer be on applications. So on October 15th, you will be able to enroll people that have end-stage renal disease into a Medicare Advantage plan for January 1st effective and moving forward. Okay, so throughout 2021, we'll be able to help those folks that have end-stage renal disease for the first time. And if you've been in the business for a while, you probably have a list of folks or know quite a few folks that you've bumped into in the past. Probably not a lot, but they're out there. And I will tell you that as far as marketing is concerned, if you're going after these folks, that's fine, but we have to be very careful on how we're helping these folks and how they work with the physicians and the doctors, okay? Because ESRD members are typically really, really expensive patients, okay? And that's because they have to go to dialysis oftentimes 3 times a week, sometimes more, 3 times a week in order to get their blood cleaned in the dialysis service. So it's a lot of work, that they go through, and that's why it's so expensive. So I want to talk to you about who would be a good fit for a Medicare Advantage plan and what type of patients should go on Medicare Advantage plan if they have ESRD. And the biggest takeaway would be whether they are compliant or non-compliant. Okay, and what I mean by that is, are they compliant? Do they go to their doctor? Do they take their medicines? Do they do whatever it takes to listen to their doctor and stay out of the hospital, and they go to their dialysis when they're supposed to, and they get their lab done when they're supposed to? That is what we identify as a compliant patient. Great person or prospect for a Medicare Advantage plan. Even so, for HMO style Medicare Advantage plans, I think that would probably be, that person would be a good fit. Now, on the opposite end of the spectrum, you have non-compliant patients, people that don't go to dialysis when they should. They don't take their medicines. They never go to the doctor. They go to the hospital 2, 3, 4 times a year because they are non-compliant. Those folks are probably not going to be a good fit for Medicare Advantage. Maybe on a PPO product because the doctors won't have to really manage that patient so much, but definitely not an HMO product because it will cause a disaster for the person, a disaster for the health plan, and a disaster for the doctor because the doctor then cannot manage that patient. They're non-compliant. They're just not listening. And so knowing that when you bump into these folks that have ESRD, I would just be very cautious on when you're starting to talk to them, trying to figure out whether or not they're compliant or non-compliant. If they're compliant, hey, that's a great prospect for a Medicare Advantage plan and probably a good fit. But if they're non-compliant, that could cause a serious issue with the healthcare system. Maybe they're better off staying on original Medicare, and hopefully they have Medicaid or something like that to help them with their 20% on the ESRD. But something, just to answer some questions that I've gotten about this, and I'll open it up to questions at the end. But, the main thing is wouldn't this really hurt the health plan, or wouldn't this really hurt the doctor if we enroll people in ESRD? And the answer is not necessarily. And again, those two folks, if they're non-managed, then yes, it's definitely going to hurt them. But if they're managed, you have to remember that Medicare gives these doctors and health plans additional funding, a lot more money than the average bear, to manage these patients because they have a significant medical condition that costs so much money. So Medicare will actually give that doctor and give that health plan more money than normal than a regular member. But again, that's money well spent if the member is compliant. But if they're non-compliant, if they don't pick up their phone, if their case manager can't get a hold of them, if they're not going to their doctor's appointments, yes, that is going to cost the doctor and the health plan a lot of money for that member because they're just not a good fit. It's a really bad thing that's happening. It's just costing the healthcare system a lot more money. So that's the big takeaway. And then the other thing too is marketing. Where can you find these folks? Where are most ESRD members going? Well, dialysis centers would be a perfect example of that. And I know that dialysis centers will probably get a hold of from agents. I've been called by a dialysis center or a member that somehow found out about me because they were talking to a patient at a dialysis center, and they called me, and this was years and years ago, but those folks are looking for help and information, and again, the compliant patients, great, but the non-compliant patients, probably not a good fit. And then, of course, your nephrologists, those kidney specialists, those kidney doctors, those are folks that obviously are diagnosing these people with ESRD and can give them information on health insurance. Now, these are people that, in my opinion, really need help, okay? In my opinion, dialysis is very expensive, and unless you have that 20% covered, that's, it could wipe you out financially. And that's our job as insurance agents, is to protect the community from financial disasters, right? So take that in consideration. Just make sure that you're doing your due diligence. And again, that non-compliant versus compliant patient, I would put, a non-compliant patient, just leave them where they're at, or maybe a PPO product might be an okay fit for them, or maybe a Medicare supplement, But a compliant patient, if they're doing what they need to be doing, then an HMO might work well for them too. So just take that into consideration. But that's another opportunity out there to grow your book of business and serve those that really need it the most. And that's why I got in this business, is really to serve those people that really need it the most. And I can think of no other group of folks that need that help than those that have kidney failure. So they're out there. Do what you can. So with that, I'm going to open it up to questions, so bear with me one second. Again, I did ask everybody to mute themselves, so you may be on mute on your own, but I'm going to unmute everyone, so if you have any questions, time.
I have a question.
Sure, go for it.
If you have to health certification, do you also have to take the Advent Health, or is one sufficient for both?
You do have to take each carrier's specific training. So if you did do AHIP, then you'll need to do your AHIP, and then you'll have to do your Healthfirst training as well.
But also the Advent Health, if you plan on selling both.
Oh, I'm sorry. No. Healthfirst includes the Advent Health training.
Okay, and then also for the WellCare, as long as you do the Centene, you're good with the WellCare too?
That's correct. So Centene has combined all of their product trainings into one training session. So if you have your license in other states, they have HealthNet, they have Centene. In Jacksonville, they have Ascension Complete, and then, of course, WellCare, and then another one in New York called Fidelis Care. So all of those companies, they now have one combined training, and that's through Centene. So you're sent out a link on that, and I think it's called the ACT now. So just like WellCare, they kind of stole that name from them. But that one training does it all for all carriers.
Thank you.
You got it. All right. Any other questions this morning?
Justin, how you doing? This is Will.
Hey, buddy. How are you?
Okay. I had a couple of questions. One, I was looking for that Plan E. What is Plan E?
Medicare Part E, you mean?
Yeah.
Yeah, so Part E, yeah, great question. So, and this goes more into detail on your AHIP. But Medicare Part E is actually the supplements now. So they're combining and putting everything into Medicare as Medicare Part E, and that's your supplements. So your Medicare supplements are now considered Medicare Part E. And again, you can learn more when you take your AHIP test.
Does that mean that you get you take your premium and have it deducted from the Social Security check, or is it still separate in that regard?
It depends on the carrier on that. Some carriers do ask that you pay separately. Some do have the option of having it deducted from your Social Security check. Okay. So the answer is it depends on the carrier.
So Justin, going back to that plan, are they now requiring certification for supplement plans now? Is that what you're saying?
No. If you do your AHIP, that's going to cover your Medicare Advantage and your Part D. But the supplement training is no. The answer is no, you don't. But you do need to be contracted and certified with the specific Medicare supplement that you're offering. So that is separate and away from that. But I anticipate, and now that I'm seeing that Medicare Part E is your Medicare supplements, I'm anticipating in the future that most likely those Medicare supplement agents will have to take AHIP in the future. But as of right now, it's not required. Yeah.
No, the other thing.
Trainings do have, like United Healthcare makes you take the supplement training.
Right. Yeah. If you want to sell their product, you have to take the Medicare supplement training. Absolutely.
Yeah. So that's Aetna as well.
Yep.
The other question I had is in relation to the companies that you have that are, because I got a couple of people, a family actually, North Carolina, and I know Humana is out there, but they just sell supplement plans, and I think Aetna. What other companies do you folks have that are, for North Carolina?
So, as in every area, we have our license in North Carolina, but the plans vary per county. So the best way to learn what plans are available in the county is by going to Medicare.gov, and you can type in the zip code, and it will pull up all the plans that are available in that area.
Okay.
Yeah, that's probably the easiest way to find out exactly what's available. Now, right now, you can only see 2020 plans, but we anticipate by the end of September, early October, you should be able to see the 2020 and 2021 plans available. Because remember, some plans are going to expand into new areas, and that's what's happening, right? So, so for instance, Devoted's going into Ohio, so they're not showing in Ohio right now, but in October they'll be on that list in Ohio. So just as an example, that's what's happening there. So just make sure you check back in each county. But Medicare.gov, that's your secret weapon right there. Don't forget that you have that.
Okay. All right. That's good. Thank you. Appreciate it.
Absolutely. Great questions this morning. Any other questions for me?
Hey, Justin, Kelly, one real quick question. Did you say that there was a United Healthcare training today starting like now at 9:30? or is that Wednesday?
Yeah, well, it's not specifically a training. It's a coffee talk. So Al and Deb are doing a coffee talk where you can call in and and just kind of free format. You know, if you have any questions about United Healthcare or maybe marketing tips, or if you need supplies or marketing materials, they'll be at your disposal at 9:30 until about 10:30, and they're doing that. It seems like once or twice a week, just to make themselves readily available for you in case you need anything from United Healthcare.
Okay, but I think this Wednesday at about 9:30, wasn't that going to be the Jarvis training for electronic signatures?
Yeah, that's going to be for Lean, and that is correct. At 9:30 on Wednesday, they're doing a WebEx for Lean, and that's their EAP system. Yep.
Are all the carriers going to be putting out some additional trainings as the days roll forward to teach us how to do their systems, their process on electronic signatures?
Oh, yeah. So just remember to keep checking your emails. You know, as we see these specific trainings rolling out, they are available. A lot of them are getting smart, and they're recording them and making them on demand. So anything that we have on demand or that is downloadable, we're saving in our gold keys. So just make sure you're going into the gold key and taking a look at what's available on those EAP training tools. I know, for instance, WellCare, their trainings are on demand. If you look at the bottom of their emails, it has all the links to all the training sessions available at your demand, so you have those. But if you're looking for a specific training on a specific EAP system and you're not finding it, that's why we're here. Just give us a call or email us, and we'll be glad to connect you and make sure that you get that training done. And if we can't find it, then we'll set it up for you. We'll make a special session, and then if we have to, we'll record it, and then we'll have it available for you. So we'll do what we can to make sure that you're properly trained on those items.
All right. Thank you.
You got it. All right, guys. Well, I want to thank you for being on the call again. I really appreciate you taking time this morning. And just remember, we do have a YouTube channel where we're recording all these. So if you need to archive or go back and see what's going on in the last couple of weeks, I do have all of these trainings recorded. Make sure that you hit subscribe and your notifications are on, the little on button there. So that way when we release a new video, you're notified right away, and you get the information fast and fresh. So we really appreciate it. I hope everyone has a fantastic week, and go get them.